All right. Hi, everybody. I'm just putting a little note in here. Yeah, give me just 1 second. Feel free to introduce yourself in the chat. I'm going to be asking for some participation as we go through this because I'm going to have everybody on here um, sort of help me out with putting in some fun facts when we start doing this customization. So, I'm going to give just a couple minutes for people to come in. So feel free to introduce yourself. Um, you can ask me questions. This should be a whole lot of fun, I think. At least I hope. I just have to find back where my chat went to because sometimes I lose things. All right. So I see a couple people on here. All right. Perfect. So while we're waiting for people to join, I'll just do a really quick little intro. I'm Dr. Stephanie Justice. I'm the director of simulation here at Intellect. And I'm really excited about this because I get to show you probably the most fun part of my job, which is actually building simulations. So as we go through here, you can put in questions in the chat. I will do my best to keep up on looking at the chat. And then we're going to build a patient and an actual multi-patient simulation, and we're going to customize everything as we go. So as we're going through, I'm going to ask you to put in some extra little things for me, like maybe some of the names that you want or a condition, something like that, so that you can actually see that you really can customize instead of it just being me telling you how great the customization is. Because I think it's much nicer when you can see things. So this is great. I'm excited to see people coming on. I see we've got a nice variety of people from different areas, and hopefully we'll get a few more. I'm not going to make you wait too long before I start sharing because I could do this all day. I love customization and it's pretty fun. So, probably just another minute or so. I'll probably start at right about 12:03 to go ahead and start sharing my screen and showing you everything that we have. And then if you have questions, feel free to drop them in. And if you want to ask any questions, I'm good for whenever you want to start. All right. About 15 more seconds, and then I'm going to do the fun part and let you see it. If you have any trouble seeing my screen, please let me know because I can make it a little bit bigger if I need to. All right. Now you should actually be looking at my screen and instead of me, which is really kind of nice because this is our actual live environment that we have. So I'm in as myself as my admin, and I'm in one of our fun schools that we have where we can kind of play around in. And I really can't mess anything up in here. So what's fun is we have ones for APRNs. We have about 130 simulations in here. I am not an APRN, full disclosure, so that's not the simulation that I'm going to be building. We have them down through assessment, community health, leadership, med surge 1, 2, critical care, peds, OB, and we have our we have a new newborn baby, so you can actually do a simulation where you can assess mom and baby, and you can talk to mom and dad. And then we just added our toddler, which I'm really excited about. So we do have a toddler available now too. So what I'm going to do is I'm going to show you, I'm actually going to pick my favorite. I do have a favorite patient in here. Probably should not have a favorite, but I really do. And my favorite one here is Henry. I love Henry. And he is actually, I'm going to do where he's having a heart attack. He's my favorite patient. And when you go in and you take a look at all of our simulations, you'll notice we have a couple things down here. We have a copy button. We also have an eyeball. The eyeball lets me view just kind of like the overview of it. So, what's going on in it, what my competencies are, how it's mapped, what kind of equipment and things I have in it, what's going on with my patient. This one's Henry Davis. Any lab results that are going to show up for students. Also, any medications he's on. Here's his environment. And then documentation that they'll do in the sim. This is the right answer. We don't give that to students. We want them to figure it out. because it's very important if they're taking a listen to a patient that they actually understand what it is that they're hearing. But this is our faculty or our educator resource, which is really kind of nice for them. We do also have debriefing. We have some NCLEX style questions in here, and those are the correct answers. It auto grades students and they get their rationale with it. And then we also have debriefing and reflection. So that's just kind of an overview of what's in this simulation. And I'm going to copy it. So I'm going to make a copy of this simulation and we're going to call it Steph's demo. And what's really kind of fun is after we make this, we're going to record it. We're actually going to run the simulation and record it. And we'll be posting that up on our LinkedIn so that you'll be able to see everything that we put into the sim so you can see it actually does work. And so I'm going to go in here into my unpublished because this is where I can play in it. And you see I have a couple little buttons here that just added up. I have the edit where I can view, that brings up that overview. I can click this pencil, which is edit, and then I can publish it. I can also trash it, but I'm definitely not going to be doing that one today. So I'm going to hit pencil and I'm going to edit. And the first thing that I'm going to show you in here is just kind of an overview of how our simulations work. This is going to have a nurse's station, a patient room, and then we're going to add another room. And then we're going to create that patient from scratch. We're going to build them and we're going to build their chart and their actual scenario. I did kind of prep for this a little bit, so I have a few things that are ready. In here, any box that you can click on, I can change the text in it. And you notice when I even put that space in, the little save button came up. I always joke they put that in for me because I forget to hit save. We can tag it for different things. I'm going to add multi-patient because I'm going to put another patient in here. Our pre-briefing is that little document that you looked at the beginning, minus the answers and minus things we don't want students to see from the beginning. We actually generate that here in our overview. So when we're done, I'm going to create a new one that will have both patients in it. Here we can edit our debriefing questions. We can add them. We can take them away. Same thing on our clinical judgment. It auto grades it so that when a student answers it, they'll find out if they were right or not. And then also debriefing down here, we have some reflection questions. These are done on the computer, not actually in the headset, because if you've ever tried to type in VR, it's not the easiest thing. Our platform does work on PC as well, so you can do PC or you can do a VR headset. We have learning objectives and also clinical outcomes. Once again, you can add a new one or you can take one out. When I go into my scenes, I have my nurses station, and this is where our students start out. You can see I can change my environment, but we like to start them with the nurses station. And in here, we have a physical character. So we have our nurse, Sarah, and nurse Sarah is going to give them report. After we add our second patient, we're going to go in here and we're going to have a little fun and we're going to edit what she can say so that when we actually play it, she will say something that somebody tells me they want her to say. We do have some pre-made grading rubrics. I actually don't have any of them tagged for this one because I'm going to use them in my patient room. So here's Henry. So a couple really nice things. I can copy the entire simulation if I want and make a second room. And if I make that second room, I can make it like a different point in time, but I don't have to recreate every single detail. You also can do like unfolding case studies. So I could have him in an outpatient clinic later for a follow-up visit and have the students follow him as he's going through maybe his cardiac rehab. All of my equipment in my room, if it is blue, it is in there. So if I wanted to put a Chucks or an underpad under him, I would click that button and I'll go up to the top and say save. And now he has a Chucks under him. If I'm doing a very basic simulation with a brand new learner who maybe I want them to focus on communication, I may take some of these supplies out. I have Henry here. He's my favorite patient. And then I have my doctor and my nurse that are both available on the telephone that can be called in the simulation. And I can even add a physical character in here. So for example, if I wanted his daughter or his wife in the room, I can add another character. What's really fun about this is any of our characters, you'll notice they all say edit. I can go in and edit their knowledge. I'm going to show you that in just a minute, but just wanted to point that out. This documentation is anything that they're going to answer in the headset or during the simulation on the computer. And when they do that, that's going to be questions. It can be assessment questions. It can be something like, for example, this one: how oriented is your patient? I have done ones before where the whole point is to communicate. And so they just acknowledge that they have met these things and they're going to be writing up their note maybe at the end. Or if it's an NP, maybe they're going to do a SOAP note. We have some pre-made grading rubrics, and these will auto apply certain grading things to them. So, for example, if they're not going to give medication, I would click that one off because I don't want them to get graded on something that they're not going to do. We also have our scripting, which is our behind the scenes, and I'm going to show you that when I do my second room. I am going to click add a new scene, and hopefully it did my little add a new scene here. That's going to be my new room where we're going to put our other patient. I just want to show you something really quick on Henry because I told you he's my favorite, but we can edit everything. Let me save that other room. I told you I forget that button all the time. Save, and I'm going to shrink that room up. And now I'm going to go look at Henry. In here, I can change everything on Henry. All of these are boxes I can type into, so I can change everything from vitals history to his diagnosis to his I's and O's. I can change his presentation and have underlying physiology. Of course, he's having an MI. I can change vital signs, his behaviors, his position. So I can have him like sitting on the edge of the bed. The really fun thing about that is I can have him sitting on the edge of the bed and I can ask him to lay down just by saying, "Hey, Henry, will you lay down?" And he actually will. It's pretty cool. I can put in my orders. We're going to be doing this in the next room when we start working on our other patient. We're going to add in all of the orders. We have them for nursing, diet, lab, imaging, and activity. We can upload notes. These are all going to be PDFs. And I actually have another screen up here where I started building a few things so that you don't have to watch me type because nobody wants to watch that. And I can upload my PDFs and then students can pull that up in the simulation. I have my lab results. We do have some templates so that you can put them in and it will bring it up like this. The reason that my CBC is purple is because you have to pull a purple top to actually give the get the results. If they send down the wrong color top, they won't get these results. If I don't want my students doing that and I want them just to see the labs when they start, I just click this button, it turns gray, and now it appears in the chart. But in this one, they're going to be drawing 3 different tubes of blood. I have my med sheet here. We have, I'm not sure the actual count of how many medications we have now that we can add. It's probably 300 or 400. And we do add new ones. So if you are one of our clients and you need a new medication, we can add it. And then we build in physiology behind it because we actually want it to work like a real medication. We want our patients to respond, especially if you make a med error, especially if you give too much of a medication or not enough. We do want them to react. So in this one to start out with, he's only on losartan. He does not have a continuous drip. He's pretty easy to start with. His assessment's going to be all drop down, and you can change things like your cardiac rhythm, your edema, pulses, cap refill. A couple of my favorite ones actually come into the pulmonary. Obviously, respiratory pattern is a big one because if you've ever used standardized patients, they don't chain stoke for long and still feel good. We do have the different chest shapes. And in addition to the kind of the standard COPD patient with the barrel chest, we do have a few others that we have with things like scoliosis, kyphosis. And you actually do see that on your patient when you take a look at them. My absolute favorite, though, is here, and that's the clubbing. And I love that one so much because my first job was in a on a lung floor, and so I had so many COPD patients. And as you know, we can't club real people's fingers or mannequins, but if I click this and make it yes, you'll actually see that his fingers are clubbed. It's very, very easy to add that to our patient. Scroll back up here. And then I talked a little bit briefly about customization of our AI. So these are things that we have built already on this patient when we made Henry. We have him a 60-year-old male with a history of high blood pressure, high cholesterol. He's scared of doctors. He's anxious. He gets a little panicky, but he's also very nice and very respectful. Down here is known knowledge. These are things that he will never vary from. He's married, but his wife's at home taking care of the dogs. Um, what's really sort of fun in here is we didn't tell him what his dogs are named. So if you ask him what his dog's name are, I don't know what he'd tell you. He'll make something up. If it's something that's important, I can actually put it in and put in new knowledge. Um, if anybody wants to give me two dog names, I can add those in. And then when we ask him that question, when we record it, he'll actually know the answer. So if anybody wants to throw a couple dog names in the chat, I can go ahead and add those in. Otherwise, I'll name them what my dogs are named. Batman, I like it. And what's the second one? I see. Should he be Robin? I mean, because that kind of fits. Oh, Reggie. Oh, we're going to give him three dogs. So Batman, Reggie, and Rio. And up here, I'm going to take care of his wife is taking care of the three dogs. And when we make our recording, we're going to have to take a look at that because it's kind of fun. You can also put in like little notes here, things like if you wanted him to be in one of your local hospitals. For example, I am here in Columbus, Ohio, so I could have him at one of the hospitals here. Um, and it's really kind of nice. So you can make it seem a little bit more real because it's all conversational AI. There's not a drop down to talk to your patient. You just look at them and ask them questions. All right, so there's my kind of little tweak on him. So we'll have to remember on Henry that we got to ask him about his dogs. So down in my third room, oh, by the way, I can edit my doctors. My joke is I can take Dr. Bell and with a couple clicks, I can make him go from being formal, professional, focused, compassionate, professional, and confident. And I can turn him into the one type of doc that nobody likes to talk to, the one that might hang up on you. So you can actually change the type of patient or the type of like provider that you're talking to so you can work on that dynamic. I can change how he talks. I can make him condescending. I can make him not very nice, but I'm going to leave him nice. Dr. Bell is a nice doc. Um, I am going to show you down here for my new patient. I need a female name, first and last name, and I will go with whichever the first one is that I see. So we'll see who's fastest. Because saw there were quite a few more dog names that came in. Because this is going to be our patient that we're going to create. So I need a patient name. And I made it a female patient. So first and last name, because Jane Doe's just not very much fun. I'm still waiting for someone to put one in. I could name her, some of the dogs. Harriet Holman. All right, there we go. This was the first one that popped up from Denise. So we're going to make a Harriet Holman in just a minute. So in here, we're going to have her in the hospital room. I can add in all of the supplies that I want. I have made this patient where just in my basic stuff that I started, she has pneumonia. And I'm going to click all my buttons. So I added my supplies. We will end up changing our patient in a minute because that's not who it's going to be. We have to make her first. And then we can add in our phone characters. We can put in a physical character if we want. We will change our documentation, our rubrics, and then we're going to play a little bit in the scripting. So really fast, I'm going to hopefully not make you sick scrolling. I'm going to go up here and I'm going to save this. Now I'm going to go build my patient. We're going to go build Harriet. Now Harriet in my sim is actually only 45. So we are going to build a new patient. So it likes to start out with our Jane Doe. If I go in, that's just how it defaults. But we're going to pick her and her name is Harriet. And she's female, and I made her 45, which I should have done my math ahead of time for whatever year my 45 years is. Let's see. So that would be 80? I don't know. I'm tired. 81? Is that right? I don't know. We'll see what that comes up as. Maybe. Yep, 45. Hey, I did that math really quick. Now here's where I get to decide if she has any allergies. Do we want her to have any allergies? Any yes, no? All right. I'm not going to make you sit here and wait for someone to tell. Oh, peanuts. Yes. That's a fun one. We've done that a few times. I can go down here and I can add an underlying chronic condition if I wanted. But I'm not going to do that on this one. I'm just going to go in and I'm going to play with the patient a little. I get to pick what she looks like. Any preference on which patient that mine looks like? I have quite a few different female patients. There's my little toddler. He's pretty cute. And you'll notice some of our characters here say they have white coat nurse scrubs. That's because if we put them in the scene, that they're actually going to be dressed like a medical professional. Do we want to make Harriet Asian, Arabic? Any preference? Anybody mind? Hispanic, Caucasian, African American? No preference? All right, then I'm going to pick Arabic just because it's the one I was looking at. So now I'm going to save. So I just changed how my patient looks. And now we're going to go in here. And we get to pick her voice. So we get to decide what she sounds like. Um, I'm going to go with, we can make her British. Um, I'm not sure if my sound shares.
Oh, brilliant! Just what I needed. And
Did you guys hear that or not? I'm not sure if it shared for you guys, but I can change what language she speaks. I can make her, she's middle aged. Oh, perfect. Glad to know you guys could hear it. So now I get to tell them about Harriet. So Harriet is a 45-year-old woman who presented with shortness of breath, and a cough. So I'm just giving her a backstory. And since I'm in Columbus, we're going to say that she works at The Ohio State University as, well, we'll make her a professor of English. And then I get to do her motivations. So her motivations can be things like, she's motivated to answer the nurse's questions and get home soon. If I put things in like flaws, those are things that they like kind of really focus on. And I've done some sort of fun things where I have made flaws like a patient that doesn't like to be called honey or sweetie. And you can put little things in like that if you want them to focus on something. You can give them hobbies, like maybe she likes to crochet. I don't know, walk her dogs. You can probably tell I am a dog person. And maybe she likes to cook. And I'm going to save this. And so now she is a professor of English at Ohio State and has 3 kids and really wants to go home. In here, I have some sliders which let me change their mood and personality. So I can make them very sad or happy, or I can put them kind of in the middle of the road. I can also make her very angry, or I can have her very calm. A lot of these, sometimes I make them kind of middle of the road, depending on what I'm doing. If I want to make them a little bit more difficult, I might make them a bit aggressive or much more agitated. I'm not going to make her quite that mean, but I'm going to, she's very calm and composed, but she's, extroverted and confident. So she should be fun to talk to. So I'm going to have her talk in less than 15 words, just because sometimes AI can be kind of chatty. Um, she is, I don't know, I can make her happy and calm. I can change her character traits. So maybe I don't know. Any ideas? Anyone have any specific character traits or type of dialogue? I can do up to 3 on each. Maybe we'll get rid of calm there. She can be polite. She can be any preference. And it takes a second for you guys' chats to come up. All right, I'm going to save that and I'm going to go past that real quick. So here is where I'm going to put in that known knowledge. So these are things that they will always know. Ooh, sarcastic. That'll be fun. I'll have to add that one. So these are things that she always knows, like she understands the current date. So, which means if you ask her what day it is, she'll be able to answer that. She was January, I can't spell, January 1st. I think that was what, 1981, maybe? I'll double check that in a minute. Is allergic to peanuts. Is coughing up thick green mucus. Let's go home. Anyone have anything really fun that we want to have her know? Been coughing for a week. Has fever. Is married. Her children are 12, 10, and 8. She knows pi to 20 decimals. I have not tried that one, so this one should be fun. All right, so we'll put that one in there. So we'll have to remember, we have to ask her that question. I kind of like sarcastic. And I'm going to make that her character trait. And we're going to save that. And yes, she has spent time with family that is sick. All right, we're going to save that. And then we're going to go into safety. I would say on the known knowledge, I think the longest I've ever gotten on someone was, I think I have 130 like things that they needed to know to be able to answer their questions. Here we have a willingness to discuss whether or not they will cuss, talk about violence, adult topics, alcohol, substance use, politics, and religion. If we put them on strict, they won't talk about it. If we say mild, they will, maybe not as quick as if we put it on loose, but they will talk about it. But if I put loose, I can put in that, like that she loves to cuss or things like that. A lot of times I leave those kind of at middle. I always say that, like, if it's talking about alcohol, when they're on mild, that's like most of my patients where you ask them and they might not give you the most accurate answer the first time you ask. If it's loose, they're going to be like, heck yeah, I do. So that's just kind of how I think of my patients there. All right. I saved Harriet and I'm going to publish Harriet so that now I can go back into my scenario that we're building. And I'm going to go to my scenes, which are my rooms. And here's Harriet. And now we're going to go in and we're going to change my patient. So I'm going to add Harriet. Look, there she is. Here is where we're going to edit. Oop, I forgot to save. I do that all the time. I told you guys when I started, I do that all the time. We're going to go in and we're going to edit. So we're going to put her in room 1, 2, 3, 4. And she has been here for 1 day. Her doctor is going to be Dr. Bell. And she is in with pneumonia. And she also has diabetes because that's how I built her. I'll make her a full code. And pneumonia. And then I'm going to put in her intake. We're just going to say 750, and she's put out 675. Over here, I'm going to change her presentation. So this is kind of the default that she's going to go in with a pulse of 75. I'm going to change it. I'm going to have her breathing a little bit fast. We're going to make her a little hypertensive. We'll do 88. We'll make her pulse ox a little bit lower, 92. Blood glucose, let's have a little fun. She's going to be 358. And her temperature, 101.7. Under her behavior, I have quite a few different things that I can pick. Everything from short of breath, and they will have kind of like a heavy breathing when you go into the scenario. I'm going to make her a little short of breath. And I'm going to have her, we'll have her sitting on the edge of the bed when you first go in there. I'm going to save that. Here's where I get to put in my orders. Now, for the sake of time, because you don't need to watch me do everything on a cut and paste, I'm going to put in a few different orders. I'm going to have them present so they show up. And what I like to do, because I, as you've seen, don't necessarily type that great, I have a list of some of my common orders. So things like monitor my vital signs every 4. I can actually go in and just cut and paste. So one thing that's really nice with this is I can go to my my scenarios if I have one that's already pre-built that I want to move over to the digital space, and I can do some cutting and pasting, which does make it a lot nicer. Obviously, I can do these things for diet. So if I did my diet, I can do like consistent carbohydrates, my labs. I can put in whatever I want. If it's something, I can put these in like this and have it collected so that my students know when they go in. She's going to have a chest x-ray because I already made one. And that's going to be present. And I am going to have her a bad lib and present. So now she'll have some orders that are going to show up. Normally, I would have quite a few more, especially on my patients that are, kind of complex. Over here, I actually made a history and physical ahead of time. Actually, I made her 54, so I do need to change her year. And then, because we made her 45, so we're going to change that. And so now I can download this and I'll be able to upload this into my chart. So I'm going to do a download here and that will show up on my computer. I have my chest x-ray here. We'll make that go away. I have my chest x-ray, which I'm also going to download. I went ahead and made that this morning. And it will pop up in a second. And then little things that I like to do is you can put things in like medication sheets. So I have one that I've made for metformin because I made her diabetic. And you can put this in as a reference for your students. So this is something else that I can download. And it'll pop up. I'm going to make it go away again once it finishes. And then we're going to actually add these into the chart. So we'll go back over to Harriet. And under our notes page, we are going to add these in. So I'm going to do HMP, and I'm going to upload that file. What's really nice with this is it can be anything that I have done. You can see I have a whole lot of things in here. I'm going to upload it and add a new note. And I can do metformin and put that one in. Upload, and then we're going to do my chest x-ray. And what's really neat is when we do our demo, when we do record this, you'll be able to see these in there. And the last one was radiology. Okay. Radiology. Upload. Sometimes I forget to hit that upload button and then I can't figure out why they're not showing up. All right. Now I can go into labs. And one of the things that's really nice is I can add panels from a template. And this is probably one of my favorite things because I don't have to remember all of the normals. So when I go in here, I can go ahead and add in my results. I can add in another one so I can put in my CMP. Um, Hit save here. And then I can go in and add the results. Now, what I will end up doing is I'm going to go back and update these after this call because I don't think you guys need to watch me do this other than I said her glucose was 384, I believe. Um, I have these in my H&P, so I want to go through and make sure I put in ones that match, just so it makes a little bit of sense for you guys. If you want to add something in that's not here, you can pick a new panel. So for example, if I wanted to put in something like a lactate level, I can add in a new panel and drop it down here, and I can add in lactate. And then I would put in the result, the reference range, the status, the category. What's really nice is if I'm like, nope, didn't mean to do that, don't really want it, I can actually trash can it and make it go away. And as you see, it went back to up to date. When I click MAR, I can add my new record. It always defaults because it's alphabetical. So until we get something that comes up earlier in the alphabet than the pediatric dose of acetaminophen, this one's always going to come up first. I can start typing and you'll see my metformin comes up. And I'm going to drop it down and I'm going to make her dose 500 milligrams twice daily. If I don't want my students to have to give it, I can make it where it has been given, or I can make it due in the future, or I can actually make it due now. And so now when I put this in here, my students would actually need to give this medication. I can add in different meds depending on what I want. So like if I wanted to put in an antibiotic, I can go look one up. For example, I can give a different IV medication if I want, or I can have it where they talk to the provider and it gets added and comes up as a new med. And that's actually what I would want to do in this one. On her, I can go in and I can change things on her assessment. I gave her a right lower lobe pneumonia. So I'm going to give her some bronchi and we're going to give her some crackles. I'm going to let everything else be pretty normal on her. I am, however, there we go. I'm going to make her pretty warm. And I gave her a temp, so I'm also going to make her a little sweaty just because she's a little toasty in here with her fever. I can go in. This is the AI. You're going to see this is everything we created, which is pretty short because we didn't put a whole lot of time in it. And I can actually override different things. I can make her very direct. I can add that to this now. And I did that because George sent that one in. So I just added that to her. It didn't change the core patient that I made. So if I wanted to use Harriet again, she doesn't have this part unless I change it on the main patient that I created. I can go down here and I can add in phone characters. So in here, oh, I haven't copied my doctor over. I can add my doc. I do need to make him, and I can do that in a minute. I also can add in physical characters. So if I make like a next of kin person, just like I made Harriet, I can have them standing in the room. If they're standing in the room, you can actually talk to them and ask them questions too, which I think is pretty fun. Obviously, she has some pneumonia and I want them to do vital signs, medication safety, and I'm going to have them call the doctor. So I definitely want them doing some SBAR. And I go up here and save this. And then I can add documentation to be in her chart for the student to mark. So this can be anything that you want. Like I said, I've done everything and I put all kinds of questions in here. If someone wants to put in a really weird off the wall kind of question, I will add it in. Doesn't have to make sense because we're doing this for a demo. Because what I want you guys to see is when we record this, I want you to see that you actually get what we put in. So if someone has a crazy question they want to have somebody answer that's multiple choice, I can do that too. And we will make B be the correct answer. I can do more than one things that's correct, so you can have multiple answers, so it can be like a select all that applies as well. Anyone have any weird questions? If nobody has one, I'm going to ask if you like cats or dogs better. It makes no sense. The correct answer for that for me is going to be dogs because I am a dog person. And that's basically because I'm allergic to cats. And so I can't have cats in my house. Ooh, that's a lot of O's. And dogs. Does anybody have any weird questions they want to pop in? I can also put in links here. So, like, for example, if I wanted to give them a link to like a YouTube video, um, and in this case, I mean, I wouldn't, it's kind of a crazy question, but I could give them puppy videos or like puppy yoga if I wanted, and they can actually view that little video. All right. I'm going to hit save up here. And then I'm going to show you scripting. And scripting is kind of fun. This is how you facilitate, oh, favorite food. That would be a little harder in a multiple choice, but we could ask a couple choices. So we could have them, what is Harriet's favorite food? And if you give me some favorite foods, I can, or just one favorite food, I can actually make sure she knows the answer to that. We can do pizza, hamburgers, chocolate cake. Ooh, I can't spell. Chocolate cake and Reese's Cups. All right. Oh, pancakes. Okay, pancakes is going to be the right answer. So I'm going to mark that one blue. So we will go here. I'm going to save that. And then I'm going to put that in her known knowledge. So we can ask her that question when we see it. So when I edit, I go to my AI. I'm going to hit override down here. And I'm going to put favorite food. Kale is another answer that we got. That's pretty funny. Pancakes, but she also really likes kale. Does anyone really like kale, though? That's my question. But I made Harriet really like it. So Harriet really likes kale, but pancakes are her favorite. And she will tell you that when we ask her that question. All right. So now we're going to go down to scripting. And scripting is one thing where a lot, I have to share this one because when I asked if anybody likes kale, that was George's answer. He said no. That one just made me kind of made me kind of laugh. Um, so in here is where I'm going to facilitate my sim behind the scenes. So this is where I can make things unfold, make things happen that I want, for example. So I always do this one as my example, and it's really mean. But this is always my example in a demonstration because I think most people really get this idea. So when the user enters the scene, which means they could have been in and been at the nurse's station, they could have gone and taken care of Henry. But when they come into this room to take care of Harriet, I'm going to put in a time delay. You guys are all going to think I was really mean at my old job when I used to teach nursing, because I'm going to put in a 60-second delay. And I wasn't this mean to my students, but I'm going to go in here and I'm going to change physiology. So 60 seconds in, because I gave no break. I gave no other way for them to get out of this. And you're probably going, man, she is mean. I am going to change her heart rhythm. And just because I'm a very, very mean person right now, I am going to throw her into VTAC. If I save this, that no matter what the student does, 60 seconds after they walk into this room, the patient will go into VTAC. I gave them absolutely no way to save her, nothing else that they can do. But when they go into that patient room, 60 seconds later, she's going to go into VTAC. Now, I think that's kind of mean. And I don't usually do that to my students unless I would want them to do something like a code. So as you can see, when I click on these, they get the blue behind them, which means I can delay it. So in this case, I'm going to change it. I'm going to be a little nicer. 10 seconds in, I'm going to do an AI character action just because I think this is a little bit nicer. I'm going to have my patient, I'm going to have her say something. Um, oh, what should I have her say? You can see a few things that I've done before where it kind of pops up that her tooth is really bothering her. That was a heart attack one that I was doing for someone. Anybody have anything weird they want her to say 10 seconds in for when we go into the room? Anybody? I can just pop something. Oh, who are you? There we go. We'll have her say so. Now, when they go into the room 10 seconds afterwards, she will say, "Who are you? I am short of breath." Exclamation point. And I'm just looking to see if I get anything else because I can add something else in. I can also do things in here where I can make things happen, like I can have a phone call start. I can have the phone ring. Um, I can highlight objects to help them find things. I can change vital signs, positions, physiology. I can change equipment. I can also have things happen for times like when they move from different rooms. So, like when a movement's performed, um, where they end up um, like coming from the medication room, I can have something happen when they go to different places. And the next one is you look too young to be in here. I like that. Okay, so I'm going to save that. That's actually the only scripting I'm going to do on her. I'm going to hit save so that it doesn't go away. But I am going to show you the scripting on Henry. And I want to show you this because Henry's scripting so much more complicated than what I had that I just showed you. So as you can see, when you go in here, there is a lot. When you go this way, we have everything from when the user comes in, he says, "Please help me. My chest is really hurting." If they give him some morphine, they're going to get a grade. That's one of the things they should be doing. They give him his IV morphine, and you'll see 60 seconds later, he relaxes a little bit. It still hurts, but he feels better. And then his vital signs are going to change. When they call the doctor, when they call Dr. Bell, they're going to get new orders, and these are for new medications, new labs. And you can see they keep going, even the 12 lead EKG stat, and they're all going to come up here. When they hang up, here you go. When the character phone call ends with Dr. Bell, 15 seconds later, Nurse Sarah is going to call them and she is going to talk to them, and their little pop-up's going to come up and say your 12 lead results are in. And then they're going to get an order to prepare them to go down to cath lab. And you'll see there's different things. This is when the simulation stops. It checks to see if they gave the medication and looks for the correct dose. We have new orders that pop up down here that the PCI will be there in 5 minutes. And this one actually takes them to an end of simulation. In this one, I actually would change that just a little bit because I don't want to end the simulation since they have another patient to go see. So I'm going to go ahead and I'm going to save that up here. And we now have a multi-patient simulation. I do want to have something, I do want my nurse to say something weird. Because normally when you go to our nurse's station, she's going to give you a report, and she's actually going to give you an SBAR. She's going to tell you all about Henry, and I would add in stuff about Harriet. But I want her to say something weird that you guys will know came from this meeting. So if somebody wants to throw some random things into the chat, I will add those to what the nurse is going to say instead of what we had her saying. So not too bad that in about 50 minutes, actually a little bit less, we made a patient. Now, granted, I would want to develop her just a little bit more, and of course, my simulation a little bit more, but we have a multi-patient sim. If I wanted, I could add another room. I can add up to 5 rooms. So I can have a nurse's station and 4 patients, or I can have 5 patients. I can change the settings to the clinic. And so you can build one pretty quick if you have everything kind of pulled up and ready to go. Anything you want the nurse to say when you first go into the simulation? If I don't get one, I'm going to make something up. She can say, "Hi, everyone." Nobody put anything in the chat. So Steph put this here, told me to say this. And that'll be what she says when the simulation starts. So I'm going to go ahead and hit save because I want to leave some time for questions and answers. So if anybody has questions, oh, and I see I have a what brings you in today. I don't know why I capitalized that. What brings you in today? Now, what's fun is with our nurse, you can actually ask her questions too. So, like if you don't know what to do for a patient that's having a heart attack, you can ask her and she'll be able to answer. Um, Down here, that's actually not totally in her knowledge, but she does understand the classic and atypical signs and symptoms of an MI. And that's pretty neat because you can ask her if you need help. You also can make it where she doesn't want to give you any help there either. All right. This one up here is scripting if I wanted something to happen in like overall in the whole sim. So I'll be able to do things like make call lights go off or something like that. I can go here and take a look at my overview. And you'll notice as I go through, I've got my nurse's station, then I have Henry. Not much changed on Henry. And yes, you actually can build a scenario with a doctor, nurse, and a patient. Um, you can have one physical character in the patient room, or you can put them all out at the nurse's station. So we've done some interprofessional simulations where either you call them on the phone or you talk to them at the nurse's station so that you can discuss the case. It's actually pretty cool because that was a question that came up and you can have them talk. So yesterday I was actually working with someone to build one for NPs, and they're going to have them talk to the dietitian, the social worker, and uh, medical dietetics. So they talked with the dietitian, and they're working on discharge planning for the patient. I had to remember who it was that we were talking about. These are the right answers here on Henry, but you'll notice when we go back down here and we get Harriet, you're going to see she's allergic to peanuts. These are her labs that I have not filled out yet. Her one medication, dogs and pancakes are the right answers. I didn't put kale as a choice. And then debriefing questions in here for her as well. Okay, so the infant, I'm going to put this one up here so that the infant patient scenario is new. So for the custom infant, let me do this really quick. When you go into our infant patient room, it is in our maternity in the newborn assessment. And I'm just going to copy this one. There are some things on the baby that you can change. It's not the same sort of quite the same custom yet on this for that patient. But when you go in here and you take a look at the baby, you can edit some things on the baby. The toddler avatar, no nonverbal. I can't remember if we do have anything for nonverbal. I do know we have some things like not making eye contact. We could put that in the known knowledge of the toddler that they don't speak. And actually, if we don't pick a voice for them, they can't speak. Because I did forget to do that one time and couldn't figure out why my patient wasn't talking. Here for the baby, you can do a few things like you can change their skin tone, their vital signs. Um, we can change behavior. You can also script some of this behind the scenes. So if you want them to like be fussy, for example, when they check blood pressure, you can actually trigger that in the scripting, or the same thing for crying, those kinds of ideas. You can change if they have cyanosis and where it's at, the fontanelles, heart sounds, lung sounds, and then some other assessment findings, and they all are on drop downs here. The toddler has a lot more that you're able to customize on them because you can come up with different words and different things that they can say. Um, you could put in like, says mama or whatever it is, depending on the type of age. Did I answer your question, Alyssa? We have not put out any pre-built yet on the toddler. That is something that is on my list of things to do. I just haven't got to that quite yet, but we will be releasing some pre-builts for the toddler patient um, soon. I'm not going to give you a timeline on that because I'm always wrong when I guess my day. Perfect. Any other questions? And Alyssa too, I don't know if you have a link to my office hours because I do office hours every week, so that you can hop in and ask questions, and I can help you work through things too, so that you can get like a little bit of help with customization or doing something within a simulation if you ever have questions. Starting next week, they're going to be twice a week, unless we are, out for conferences or vacations or anything like that, and that'll be time with me one on one. All right. So how do you get to my office hours? I need to put my link in there. So that is in my Calendly here. I will just share this little link and I'll put it in the chat. Perfect. So you can see I'm on the 7th and the 9th of next week. And let me pop that in here. I changed the office hours. They're different days, different hours. Um, doing the during the week so that, if you teach on Tuesdays, I don't always just meet on Tuesdays. And yes, you totally can do the first scene as the nurse giving the student a pre-brief. That's actually one of my favorites because you can make your SBAR or your handoff report as good or as bad as you want. And that gives them the chance to be able to ask those questions. And to me, that's really neat because, I remember being a brand new grad and like I didn't know what to say. I've been doing this a long time, and when I first started, I was really confused and I didn't know what info to share, what to not share. And so you can totally do that and create that in the nurse's station. And you can give very specific knowledge to that nurse so that they can actually have to ask questions and make it into that conversation. I really do like the handoff. The really kind of fun thing I did is I built an unfolding case study, and every time you went into a room for a different point of time, you came back and you asked the nurse to give you SBAR for room 2 or scenario 2, and she would actually give you a full SBAR for each one of the scenarios. And I had 3 different scenarios in that, but only one nurse's station. So if you ever want to do something like that, I can help you figure that out too. And I'm wrapping up with like 1 minute to spare. That's pretty good for me. I usually end up running over. So, any other questions? So, I want to make sure I get you all out of here on time because it's probably close to lunchtime for most of you. All right. And you're welcome, George. I'm glad you could make it. I'm glad everybody could be here. Angela and Liz and Alyssa. And I have to scroll back up because I can't see things. But feel free to sign up for my office hours. I love to help you figure this out. And I'll be ending the stream in just a minute, unless you have any more questions, because I can hang out for a few more if you want. And which link did you want? Did you want my office hours link? I'm just going to pop that in there again if that's the one you were looking for. All right. Do you see the links? Because I've put them in and so has Intellect Nursing, hopefully. We've got them on Facebook. It looks like YouTube and here. I can send that directly to you because I don't know if it's not showing up on the platform that you're in. So we'll send those to you so that you have my hours. All right. Well, thank you everybody for coming today. I hope it was helpful to see kind of what all you can do on our platform, and I hope to see you all in my office hours. I'm going to go ahead and end our stream here. Have a great day.